Hello guys. So today we are going to talk about the evidence-based medicine. Now this is a very boring topic, but I want to cover this. My exams are approaching. Um, my exams are starting from one May. Yeah. So let's study evidence-based medicine. So so there are types of studies: case series and case reports, case control studies, cohort studies, randomized controlled clinical trials, and systematic reviews. Okay, and meta analysis. Okay, so case series and case reports, case control studies, cohort studies, randomized controlled clinical trials, and systematic reviews and meta analysis. Okay, so we have two types of study: descriptive studies and analytical studies. Okay, so descriptive study has two branches: ecological and cross-section study. Ecological research which includes whole population. Okay, ecological, it is a study in which the research which includes whole population. Okay, and cross-section study focus research on individuals. Okay, ecological means whole population study on whole population, and cross section study means focus on individual study, and analytical study observation and intervention. Okay, so analytical study is again divided into two parts: observation and intervention. Okay, so observation has cohort studies and case control studies. Okay, and intervention has randomized control clinical trials. Okay, now case series and case reports. Collections of report on the treatment of individual patients or a report on a single patient. Okay, report on a single patient is called case control series. Mhm. Okay, no control group with which to compare outcomes, so limited statistical validity. Okay, so case series is collection of reports on a single patient. Yeah, that's it. Case series and case report are the collection of reports on a single patient. Okay, it is a collection of report on treatment of individual patients or a report on a single patient. No control group with which to compare outcomes, so limited statistical validity. Okay. Now, case control studies. Okay, patients who already have a specific condition are compared with people without the condition. Researcher looks back to identify factors or exposures possibly associated with the condition, often relying on medical records and patient recall. Okay, so this case control studies, let's decode this. So patients who already have a condition are compared with people without the condition. Okay, comparison between the people with the condition and people with the condition is called like case control studies. Okay, and what is case series? Remind me. Cases and case reports are the collections of reports on treatment of individual patient is called cases, and when we compare a patient with a symptom and a patient and a person without symptom, so that is called as a case control studies. Case control study. Okay, fine. So how do the researchers look back to identify factors or exposure possibly associated with the condition? Often rely on medical records and patient recall. Okay, so this is also less reliable because showing a statistical relationship does not mean that one factor necessarily caused the other. Okay, it starts with the patient and who already have a disease outcome and looks back for the exposure. Like a patient comes to you with HIV. Okay, HIV, and you know the symptoms of the HIV. Okay, so you diagnose that this patient has HIV. So that is called the case control study, kind of. Okay, ठीक. So definition. Cases are the people with condition. Okay, and controls are the people without condition. Without condition controls. Case with condition. Okay. Okay. ठीक है. Selection of cases and control. Cases are the people with condition and control are the people without the condition. Okay. And so what is control study? So a study that starts with the identification of person with and without the outcome of our interest. A study that starts with the identification of person with and without the outcome of interest and determines whether they had a specific risk factor. Okay, so let's recall what is case series and case reports. These are the collections of reports on treatment of individual patients or a report on a single patient, and case control study is the patient who we compare. It is a comparison between the patient who have a condition and the patient who don't have condition. Okay. And case control study is the study that starts with the identification of person with and without the outcome of interest. Identification of person with and without the outcome of interest, and determines whether they had a specific risk factor. Okay. Wait, I don't understand this. So what is case control study? A study that starts with the identification of persons with and without money. Okay. It is a study that starts with the identification of person with and condition. Um, Outcome. Okay. So it is a study that starts with the identification of persons with or without the outcome. Okay. Of interest. Okay. And what is the case control? See. What? Okay. So apparently there are two definitions of a case control study. First is the comparison between the between the people who have a condition and the people who don't have condition. And second definition is like this: a study that starts with the identification of the person with and without the outcome of interest and determines whether they had a specific risk factor. Okay. ठीक है. So, one sec, guys. Um, okay. So, designed to answer a standard research question. Okay, so we know that PICO method is useful for to answer the standard research question. This is the patient intervention or exposure comparison intervention or control group, and O is for the outcome. Okay, the only difference is that the study the study population is defined by outcome and not by the exposure. Okay. Okay. ठीक है. Oh, okay. So, what is case control study? Women with and without endometrial cancer were identified. Use of unopposed estrogen therapy in past was more common among those with cancer. Okay. Unopposed estrogen therapy in past was more common among those with cancer. Okay. Unopposed estrogen therapy. Unopposed means like we give estrogen to the women in past. Okay. So the relationship between the cancer and estrogen is more common. It means that more the estrogen, more the risk factors for developing the cancer. Okay. So, what are the strengths of case control studies? Strengths efficient for rare outcomes and outcomes which occur long after exposure. Okay, and generate hypotheses about new outbreaks. Require fewer subjects than other methods. Okay, so strengths efficient for rare outcomes and outcomes which occur long after exposure. Generate hypotheses about new outbreaks. Requires fewer subjects than other methods. Weaknesses: only one outcome can be studied compared to cohort. Cohort we can study more than one outcome. Okay, very susceptible to bias. Recall, selection, and confounding. Can't measure incidence. Okay, prevalence population and attributable risk. Okay. Example: choosing your control group. Cases HIV. As we know, case is the person who have a outcome, right, or disease. Uh, one sec, guys. I guess I have forgotten. Yeah, people with condition and controls are the people without the condition. Okay. Hmm. So, example, choosing your control group, case HIV infection control, no HIV infection, exposure of interest, number of sex partners. Okay, so two control groups: controls from same neighborhood as cases and controls from local STD or sexually transmitted disease clinic. Okay, cohort studies. Take a large population who already are taking a particular treatment or have an exposure, follow them forward over time, and then compare for outcomes with a similar group that has not been affected by the treatment or exposure. Observational and not as reliable as a randomized controlled studies, since the two groups may differ in ways other than in variable studies. Okay. It starts with the exposure and follows the patient forward to outcome. Wait, just wait. Okay, so let's revise. So we have types of studies. So case series and case reports, case control, cohort, randomized controlled clinical trials, and meta analysis. Yeah. Systematic reviews and meta-analysis. Okay, so we have two types of studies: descriptive and analytical. Okay, in descriptive study is again divided into two parts: ecological and cross-sectional. Ecological study is the whole population, and cross-sectional studies, it is focused on research on individuals. Okay. Analytical studies, observational and intervention. Observational cohort studies, case control studies, and intervention is the randomized controlled clinical trials. Okay. Hmm. Now, case is a collection of reports on treatment of a individual patient or a report on a single patient. Report. Okay. Collection of reports on a single patient is called a case series case control, and no control groups uh, with which uh, with which to compare outcomes, so limited statistical validity. Okay. Now, case consider patient who comparison between the patient who already have a disease and and the patient who don't have disease. Okay, okay, and it starts with the patient who already have a outcome and look backward for the possible exposure. Okay, T. Definitions. Cases are the people with condition and controls are the patient without condition. Okay, T. So. mm, mm. Now, example of what is a case chronicity? Women with and without endometrial cancer were identified. Use of unopposed estrogen, it promotes the development of cancer. So, the female in which the estrogen therapy is used, they have more risk factor for cancer. ठीक. Huh. Now, strengths, case consistency strengths, efficient for rare outcomes and outcomes with which occur long after exposure. Generate hypotheses about new outbreaks, require fewer subjects than other subjects. Only one outcome can be studied compared to cohort, very susceptible to bias, recall selection and confounding. Can't measure incidence, prevalence, population, and attributable risks. Example, choosing your control group, cases HIV infection and control is a no HIV infection. Exposure of interest is a number of sex partners and two control groups. We have controls from same neighborhood as cases and controls from the local STD or sexually transmitted disease clinically. Okay. Cohort study. So, cohort study take a large population who are already taking a particular who are already taking a particular treatment or have an exposure. Follow them forward over time, and then compare for outcome within a similar group that has not been affected by the treatment or exposure. Observational and not as reliable as the randomized controlled studies, since the two groups may differ in ways other than in the variable study. Okay. So this cohort study, it starts with the exposure and follows the patient for an outcome. G. T. Okay. What is cohort study? Okay. Exposure leads to outcome. G. Okay. So what is the difference between the prospective and retrospective? Both observe what happens to subjects as they move forward through time. The difference is when the information is collected. Prospective outcome has not happened. All information is collected prospectively. Prospectively. Okay. And retrospective outcomes has already happened. All information is collected from the past. Medical records are another study. So let's identify some cases in which we have to determine is this statement prospective or retrospective. Remember, prospective is that study in which the outcome has not happened, and we only collect information about what we know. Okay, and in case of retrospective studies, we have the outcome has already happened. Outcome has already happened. Okay, so so we just collect the history of the disease. Okay, so to examine the effects of Depo-Provera on bone mineral density, investigation enrolled women in their clinic who were starting Depo and women on no contraception. All had bone mineral density measured at baseline every three months for 2 years. Okay, so now you tell me that in this example has the narrator even mentioned uh, the outcome of the Depo-Provera on bone mineral density? No. So this is a prospective statement. Okay. So to examine the next example, to examine the regression of endometrial hyperplasia with progestin treatment, investigators identified 185 women in a database with hyperplasia. They looked in the database to see who had received progestin treatment, and then looked at follow-up endometrial biopsies to see whose hyperplasia would resolve. Okay. So, we have the outcome of the disease. We have the outcome of the exposure. Like so the investigators identified 185 women in a database with hyperplasia. Okay, so this is the outcome of the disease. Like the disease is done. It has been done to the woman. Okay, so that is why this 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 statement is a retrospective. Okay. So um, prospective versus retrospective. Okay, it helps to identify whether data were collected prospectively or retrospectively. But what really matters is how the exposure was documented. Example: uh, association with between smoking history and lung cancer. Ask the patient now if she smoked 10 years ago and look in her chart for 10 years ago. So okay, so that's it. Okay. So threats to validity confounding. Okay. So I will give a best very nice example of this. Okay. So suppose you have a lighter. Okay. You always take the lighter in your pocket. Okay. But this doesn't mean that you have cancer of lung. Okay. The lighter can be used for many purposes, to provide heat to the body, right? To light the gas up, right? But hmm. So this doesn't mean that you have cancer. But the third factor, that is cigarette smoking. If you one second, guys. Okay. So, damn it. So what I was saying is that the okay. So I was telling about the confounding factor. When a third variable is associated with both the exposure and outcome and interface with the determination of the direct effect of that exposure confounder. Gee. Consistency of findings in different studies and biological mechanisms for the results. Okay. Fits with the natural history of disease. Okay. So, cohort studies decrease recall bias, exposure recorded near the occurrence before the outcome, establishes that potential causative factors occur prior to disease onset, can study several outcomes for each exposure, weakness, confounding can only adjust for what you measure, loss to follow-up, long follow-up required, inefficient for rare disease, expensive, large sample size required. Okay. Now, randomized controlled clinical trials. So, carefully planned project that introduce a treatment or exposure to study its effect on patients. Include methodologies that reduce the potential for bias, randomization and blinding, and allow for comparison between intervention and control groups. Is an experiment and can provide sound evidence of cause and effect. Randomly assigns exposure and then follows patient forward to an outcome. Okay. So so RCT, that is a randomized controlled clinical trials. They are three. So they are randomly assigns exposure and then follows patient forward to an outcome. So the highest level of evidence for clinical research is the gold standard. RCT is the gold standard for the research. The subjects are randomized to treatment or control groups. Makes two groups comparable. Okay. How to evaluate RCT? Uh, Study design, randomization, blinding, outcome selection, and results, um, statistics, intention to treat analysis, multivariate adjustment, subgroup analysis. Why wouldn't RCT not be possible? Okay. Ethics, evaluate. Hmm. Ethics, evaluate abortion as a risk factor for breast cancer, costly and impractical for some outcomes, rare outcomes, oral contraceptives and lip and thrombosis, long time frame, smoking and lung cancer. Observation studies have an important role. But randomized controlled trials are preferred. HRT, that is hormone replacement theory, and cardiovascular disease. Several observational studies showed a 40 to 50% decrease in cardiovascular events with HRT. No benefit from HRT in women's health initiative RCT. Difference likely the result of unmeasured confronters. Are subjects appropriately blinded? Single blinding, double blinding, both subjects can and investigators unaware of a treatment assignment. Non-blinding can cause bias. Patient may use other medicines or add differently. Provider may treat patient differently and investigator may interpret outcome differently. Crossover design influence. See. Now, systematic reviews. It usually focus on a clinical topic and answer a specific question. An extensive an extensive literature search is conducted to identify studies with a sound methodology. The studies are reviewed, assessed, and results summarized according to the predetermined criteria of the review question. Okay. So, meta-analysis thoroughly examines a number of varied studies on a topic and combines the results using accepted statistical methodology to report the result as if it were one last study. The Cochrane collaboration has done a lot of work in the areas of systematic reviews and meta-analysis. Okay. So, okay. So this is very important. Levels of evidence. So we have 1A, 1B, 2A, 2B, 3A, 3B, 4 and 5. So we will start from bottom and come towards top. So um, fifth is a fifth is the expert option. Okay. Fourth is the case series and poor quality cohort and case control studies. What is fifth? Expert option. Fourth is the case series and poor quality control, cohort and case control studies. Okay. And 3B is the case control studies. Okay. And 3A is the systematic review of case control studies. Okay. 2B is the individual cohort studies and low quality RCTs. That is a randomized controlled trials. 2A is the systematic reviews of cohort studies. 1B is the individual RCTs with narrow confidence interval, and 1A is the systematic reviews of randomized controlled trials, RCTs. Okay, let's repeat it once again. So, fifth is the expert option. First is the cases and poor quality cohort and case control studies. 3B is the case control studies. 3A is the systematic reviews of case control studies. 2B is the individual cohort studies and low quality RCTs. 2A is the systematic reviews of cohort studies, and one B is the individual RCTs with a narrow confidence interval, and one is the systematic reviews of a randomized controlled trial. Okay. Okay, guys. So we have finished the EBM. So thank you. Bye.